Well, we are in the middle of a COVID surge, and of course it is flu season. So is it possible to be diagnosed with both COVID-19 and the flu? We are here this morning with Infectious Disease Specialist Dr. Joanne Passalacqua with Hartford Healthcare St. Vincent's Medical Center to learn more about what is being referred to as Flurona. Here we go with something else to worry about. My first question for you, doctor, and thank you so much for being with us this morning, is how is this possible? Some people may have that question.
Well, certainly these are both respiratory viruses. They spread in a similar way. We're seeing an uptick in Connecticut in our cases of flu right now. We had a very light flu season last year, but we are beginning to see the flu show itself here in Connecticut. And as we all know, post the holiday season, we're seeing an uptick in our cases of COVID-19. So it's certainly possible that folks may acquire infection with both viruses at the same time. And that's something that's very concerning to us in healthcare.
Absolutely. Is it unusual to be infected with both at the same time? I know you did just say it's possible, but really how possible is it?
We've seen cases. There was a case very early in the pandemic, February of 2020. There was actually a man in New York whose swab was positive for both COVID and influenza. 2020 was a very light flu season, probably because of the lockdown and all the social distancing. But based on numbers this year, it appears that we may not have such a light flu season, and people may have lost some of their natural immunity to flu at this point. So there have been several reported cases around the country thus far. There was a case in California, another in Texas, and I believe one more in Kansas. So right now it's just scattered cases, but the concern, is certainly that these two viruses have a similar route of spread, and the rates of both viruses are on the rise right now.
And I would assume similar symptoms as well.
Absolutely. Symptoms are overlapping. So, if we get phone calls in our office with people that have flu-like symptoms, the first thing we do is test for COVID. But as influenza rates are rising, the next thing would be to look for influenza.
Right. And how is it treated? I mean, we all know how COVID is treated if you have mild symptoms. But how do you treat someone with Flurona? Differently?
So the flu in general is treated with rest and fluids and drugs like Tylenol and ibuprofen. And COVID, much the same way. As symptoms become more severe, or if people have compromised immune systems, we do have medications like Tamiflu for the flu. Now we have the new Pfizer oral drug that will be becoming available for COVID-19. So the good news is that we're coming into a time when we're going to have oral therapies for both of these entities. But obviously, if somebody becomes sick with both viruses at the same time, that's concerning in terms of how it will play out with severity of disease.
Well, we've been saying this for a while now, but I hope we get past this very soon. Thank you so much, Dr. Passalacqua, for your time this morning. We really appreciate it, and stay safe.
Thank you.